Good morning. Welcome to our coffee conversations here at Forge Breast Cancer Survivor Center. So excited to have Dr. Boggs with us to talk about proton therapy. And the topic today is Proton Therapy 101. So he's going to really walk through the basics and just some questions that we have. We're very excited to have you here, Dr. Boggs. Tell us about yourself.
Yeah. Well, first of all, thank y'all for having me. This is exciting for me to be able to come, and I think this is actually my first interaction with Forge, and so really happy to be a part of this. And so I'm Hunter Boggs. I have been in practice at UAB since 2015, and I'm primarily a breast cancer physician. If any of y'all have interacted with the UAB multidisciplinary breast cancer teams, I'm typically on the Thursday team. And so I'll see a lot of new folks that come in through there, and then we'll rediscuss radiation treatment when the time comes. So I practice downtown, but then I also have clinics throughout the different places in the state, currently one in Anniston at RMC, as well as at Alexander City at Russell Medical Center. And, one of my passions has always been making sure that folks really across the state, regardless of what access they have at baseline, are able to get the highest quality of cancer care that they need. And really not depending on where they live or where their zip code is. And so that's something that's really near and dear to my heart. I'm from rural Northeast Louisiana originally. And so I think that's one of the things that, seeing a lot of people, family and friends that have poor access to care, to cancer care particularly, and my own family really gave me a passion for making sure that that people here in this community are afforded better opportunities.
Well, thank you so much for bringing that to Alabama, that you didn't stay in Louisiana and share the love with us. So proton therapy is something new to me, right? And I know that it might be new to others as well. So could you just kind of tell us what is proton therapy? What does that mean?
Yeah, sure. So proton therapy is a form of radiation treatment. All right. So I'm going to use my hands. This is how I talk, and this is what I do with patients. And so it may or may not help, but this is what we'll do. Okay. So in general, the most common way to deliver radiation treatment is with a technique called photons, which is a machine that delivers high doses of X-ray treatments from the machine to hit the patient. All right, so let's say that here is what you want to treat, all right? And here is, let's say, your heart, okay? If you were to aim a photon beam directly at what you wanted to treat in the breast, the photon beam would come in here and it would deliver its treatment, but then it would exit out and get a little bit of low dose spread to the heart or whatever is behind. And because of that, we angle our beams and we make sure that we try to keep our photon beams as far away from the important organs in the body, like the heart. Okay. We've been doing that for years, and it's an excellent technique. What a proton beam does is delivers radiation over the same area with the same dose that we would do for a photon treatment. But the way a proton beam works is, here's the breast, here's the heart. It'll come in, it'll deliver its dose, and then it just stops. Okay, so there's no exit dose, and for specific cases, it does a better job of reducing low dose spill of radiation to important organs. And really, with breast cancer, the one we think mostly about is the heart, the lungs somewhat, but the heart is really the most important thing. So here in Birmingham, we have had the ability to have patients treated with proton therapy since really first week of the pandemic. And so that's how we market. It was almost exactly 3 years ago, almost to the day, that we started treating patients. And we very early on started treating patients, select patients with breast cancer with proton therapy. So it's been a huge boon to have this as an option for patients who need it.
And I guess you answered another thing I was thinking of about what makes it different from other radiation, just not having to, it stops where it's supposed to go, basically.
That's right.
Like
Yeah,
it
it
doesn't
doesn't
go
exit
through.
out. Yeah.
So, how cool is that?
It's
To
really cool.
recognize that, like, hey, these are some of the gray areas that we're having with something that's effective, but how can we make it better? So,
Right.
thankful for science.
Yeah.
um, so how does one know if this is covered for by their insurance, right? Like, is it more expensive than other radiation treatments?
Yeah. So, okay. So this is a somewhat of a complicated question. So in general, proton therapy is a more expensive treatment because the machine is much more complicated than a traditional photon machine. And, if y'all were around 3 years ago when they delivered what's called the cyclotron, which is essentially the machine that accelerates the proton beam fast enough to get it to a speed that's needed to enter in and to treat your cancer into your body. It is a massive piece of machinery that was delivered very slowly down through this crane, and they had to watch for wind speed and all that, and it was slowly lowered, inch by inch by inch to get in perfectly. And then this massive machine has to be calibrated within a couple of millimeters of accuracy. And if there's a shift in the foundation, any of that can totally throw things off. And so it is a very complex, expensive piece of machinery that does generally cost more than traditional photon therapy. And so really how I think about it, and how all radiation oncologists should think about it, is that the benefit needs to outweigh the cost of the medical system. The insurance companies are aware of that. So what I would say is insurance. So I think the first question you have is, does your doctor feel like that this is something that your cancer is something that would benefit from proton therapy? And a lot of the times the answer is no. We can do photon treatment, traditional radiation, and do just as well. But in those scenarios where we do think proton therapy is more appropriate, what we do is we initiate a process where we look at your insurance coverage. We have a team that Lindsay Pruitt, who's on here, they will take a look and determine what are the steps that need to be done to try to see if your insurance company will cover this. And then depending on the time that it's going to take for this to happen, for us to be able to initiate treatment, and that we're not delaying your care so much that the benefit of protons isn't there anyway, because it's taken so much time to get it approved, we will determine how much we need to fight and how many steps that we need to go through to ensure that we can have your proton therapy appropriately covered. And so it's complex. It's patient by patient. There's a lot of communication that goes on through the Proton Center, and a lot of this are things that we as the physicians don't have a lot of control over. But we've gotten over the last 3 years very well versed in how likely this is going to be covered, and if it's not going to be covered, do we, what are our options? And we try to discuss that with you all up front.
Yeah. So what I'm hearing you say is basically it just depends on your situation, and it
Yes.
also depends on who you're insured through, and
Yeah.
and what their policies and everything might look like. So I
Yes.
know you mentioned that it could benefit, but it could also not necessarily be something that a person needs. So
Right.
For those that could qualify for it, like
Yes.
what are the factors that make somebody a candidate for proton therapy?
Yeah. And so really what it is, technically we can treat pretty much anyone with proton therapy, but the question is, should we treat anyone with proton therapy? In general, I think the best way to think about it, the way I think about it in a simple way, is if I treat you with proton therapy, am I going to be able to drastically reduce the dose to your heart? That's probably the most important question I ask myself. So if you have an early stage breast cancer, the answer is usually no, because I can do traditional photon therapy and do just as well with getting the dose away from your heart as most proton patients, unless it's a very specific scenario. If you have more advanced disease, particularly, your heart's on right here on your left side. So if you have advanced disease that's kind of draping, or we're having to treat areas that are draping around the heart, and it's very hard for us to angle our beams away from where we're treating, then that may be with photon treatment, that may be one that we would more likely want to think about protons. We think about it in patients with that scenario. So we think about, well, what are other risk factors if we do give them radiation and it's going to give dose to the heart? What are other things that have happened? Have they gotten chemotherapy or like adriamycin, the red devil? If any of y'all are breast cancer survivors, you may be familiar with that one, that does have some heart effects. For patients that have something called HER2 positivity, there's something called Herceptin that can cause some issues with the heart. So we'll look and say, okay, if they've had these up front, is that going to put them at a little bit higher risk for disease? So those are some of the things that we will think about to determine, what is the benefit of doing proton therapy, versus photon therapy. I will say in general, for most patients, your chances of cure are not diminished whether you do proton or photon therapy. It's really not that. It's looking at the side effect profile. And so, our goal always is, number one, to treat the cancer. Okay. And to do that in the way that we can realistically do that and give you as few side effects as possible.
Yeah, and I guess that you definitely just answered another question that I had, is there going to be a difference in, the results? Does it, just having proton therapy versus not having it in comparison to another type of radiation really just depends on what your medical situation is, just very individualized. It just depends on, what you've already done in your treatment. I mean, what if besides even treatment, if you had some issues with your heart prior to even getting a breast cancer diagnosis?
Yes, absolutely. Yes, that's a risk factor as well that we would look at. And I think that's a good aside to just mention this, but they are asking this question in the form of a clinical trial. So that's the only way we can really definitively answer, does protons really reduce your dose to the heart in a way that's clinically meaningful? Because, if we look at it on paper and we say, all right, well, you're getting this much radiation with this technique or this, that's all fine and good, but really we want to know, does it make a difference to you? And the way that we find that out is through a clinical study that we have enrolled patients on is something called the RADCOMP study that we've put a fair number of patients on at UAB that is trying to answer this question of, does it really make that big of a difference to get proton therapy versus photon therapy? And they follow you out and they look at specific imaging of your heart, and they look at some blood work and really to try to answer this question down the road, because most of the time the heart effects from radiation are not things that you will notice immediately. It's going to be something that maybe will come up, months down the road, or really even more like years down the road, I would say, 3 to 5 years.
What are those side effects like?
So heart disease is probably one of the most common ones reported in the literature, because, your arteries that supply your heart are near where we need to treat. And we're careful with that. But what can happen if you radiate through your arteries, your coronary arteries, it can cause them to harden over time. And particularly if you already have some heart disease issues, it can sometimes increase the chances of having heart disease down the road. So that's probably the most common one. I would say the second most common one is some change in your pump function of the heart. And so sometimes what it can do is cause some scarring of the heart where it doesn't pump like it should. These are rare, and most of these, honestly, in the modern era are rare to happen from radiation treatment, because outside of protons, and protons included, we've really gone to a lot of effort to understand where the heart is, how the heart can be moved out of the way for radiation treatment, how we can block it out and still treat the cancer. I mean, that's something I've really pay a lot of attention to with all my breast cancer patients, certainly not just proton therapy patients. And what they've shown is that in more modern studies when, instead of what used to happen maybe 30 years ago where you didn't really pay much attention, you just blasted through the heart. In the modern era, if it's done well, that really the chance of radiation-induced heart effects are a lot less than they were. And there's not as much of a difference in heart disease, whether you have radiation to this area or not, which is comforting. I think should be comforting for any patients that come through, whether you need to have proton therapy or not.
That is so cool. You're saying things so casually, and I'm like, oh my God, I didn't know they could do that. Like I didn't know that you could adjust where the heart is, or make some type of thing happen where you're not necessarily affecting.
Let me tell you about one. We don't have to use this in proton therapy, but if we're trying to decide between the two, we look at this a lot. When we get ready to do radiation, we scan patients. And what we'll do is we'll scan them breathing normally, and then we put a little box on their belly that measures their breathing. And then we say, take a deep breath, hold it, and then we scan them again. And what happens is when you take a deep breath, your lungs expand, and they expand this way and this way, and it pulls your heart down and away from the radiation field. And so, when you're coming in with your beams, instead of your heart being kind of right up next to it, it's pulled further down, and so you can get it out of the way. So we use that a lot.
That is so cool. And I know that's your norm. So you were just like, yeah, we just move the heart a little bit. And I'm like, what? Like, how do you move that?
Yeah, y'all do it. Y'all do it for us when you take your breath. So.
Wow. Awesome. So if somebody wanted to kind of explore proton therapy, especially, after learning a little bit about it, learning that it's something that's out there, and wants to just be a little bit more involved in their treatment plan, and maybe they do have some concerns about their heart. What are some things that you think someone should know prior to, making that jump and saying, hey, this is something that I want to explore? Like, what are some suggestions that you have for those people?
I would say my number one suggestion is this. When you go to get your radiation treatment, you need to trust your physician, and you need to make sure that you have that rapport, and if you don't, go somewhere else, be seen by someone else. And you're not going, and this is how I see this, is that don't go in with, I must get this treatment. Okay. Go in with talk with your doctor about what treatment is going to be the best given everything that's going on. And then if you don't feel right about whatever that recommendation is, seek a second opinion. Please do that. So understand that proton therapy is a tool in our toolbox of effective delivery of radiation for breast cancer. And I think that's going to be the most helpful. Sometimes people can come in specifically because they want to see about this particular thing. And that's great. Explore that. But understand that it may not be the best tool. And if that's the case, work with your physician to come and understand that and ask those questions and say, is it really not? I mean, what is the benefit? And so I think that's the most important thing. But on the other hand, also don't be afraid to ask about proton therapy. And sometimes it'll kind of, particularly for people maybe outside of our system that don't deal with protons, it can get them to start thinking about it. And then if you want to seek an opinion, we have avenues to be able to call up here and be evaluated for proton therapy as a second opinion by myself or one of my colleagues here, and we can kind of help answer those questions for you as well.
Okay, well, thank you so much. Did you have any other thoughts or anything that you wanted to leave our listeners and viewers with?
No, I think the most important thing, I'm here as a cancer doctor, but the most important thing is going to be is prevention, right? And so I probably am, preaching to the choir with folks who are on here, but I know, that it is important for y'all to be advocates in your community, with your family, with your friends, about getting, appropriate screening, about doing self-breast exams, make sure you're plugged in with the primary care physician. Fortunately, by the grace of God, cure rates for breast cancer are going so far up. And it's because there is increased access to to screening. And so we're catching these in an early stage, and they're just, most of these are very, very curable. And unfortunately, we are still seeing, patients who come in with, neglected cancers, or it's much more advanced. And so we have to think through ways to make our treatment more, essentially aggressive to be able to treat that cancer. And so, don't neglect yourself. If you notice something, because you've got other things going on, get it seen about up front, because the chances of cure and the disruption to your life will be so much less. And y'all get on the horn and be advocates for that with your family and friends as well.
Yes, completely agree. Thank you so much, Dr. Boggs, for coming to Coffee Conversations with Forge. We're so happy that you were able to break down proton therapy and explain it in such a way that we can understand, and ask more questions. Like if somebody is thinking about this now, they kind of have something to lead with, like, hey, this is what I do know, help educate me a little bit more. So we're very grateful for you taking a time out today and talking with us and everybody on the call, and we will see you around.
My pleasure.